The Last High by Dr. Daniel Kalla explores the perfect storm of greed, addiction, and crime behind the malignant spread of fentanyl, a deadly drug that is killing people faster than any known epidemic. Dr. Kalla knows all too well the deadly consequences of an affliction that has been pushed off the headlines while the world has panicked over COVID-19, an affliction that has not gone away and is still consuming victims by the day. According to Worldometer, at the time of this recording, which is March the 7th, 2022, more than $70 billion US has been spent on illegal drugs this year alone. According to the Center for Disease Control, more than 500,000 people died in the US alone due to overdoses between 1999 and 2019. The mounting death toll came in waves. The first being attributed to an increase in prescribing opioids in the 90s. The second wave began in 2010 with a rapid increase in overdose deaths involving heroin, and then the third and most deadly wave began in 2013 with the introduction of fentanyl. Dr. Kalla's book, The Last High, is a thriller where an ER doc, just like the author himself, teams up with a detective to track down the source of a supply of deadly fentanyl that is killing teens. I invited Dr. Kalla to join me for a conversation that matters about how the best feeling you ever had could kill you, and are we any closer to loosening its deadly grip? Dr. Kalla, welcome.
Good to be here, Stuart. Thanks.
What motivated you to write this book? What were you seeing in your own life that made you say, there's a problem and we've got to start to track down its source and then hopefully maybe start to find solutions?
Yeah, I mean, I've lived professionally at the epicenter of the opioid crisis for the last 23 years. I've worked at St. Paul's Emergency, and we truly are ground zero when it comes to opioid addiction and overdoses. So, as you so rightfully pointed out in your introduction, we've seen opioid overdoses for years, and we've seen the damage addiction can cause, but the lethality in the last 6 or 7 years has been beyond imaginable. The number of patients we've lost, the number of, people who have lost their loved ones, their social networks, their everything to this crisis it's just staggering.
It's my understanding that you may take another drug, but it could very easily have had even just specks of fentanyl added to it because the people who are producing your drug supply for you are not doing so in sterile laboratory situations. Is that true? And how deadly is just that and not knowing what you're taking?
Yeah, it's such a malicious, I get into that a lot in my novel, just the absolute lack of quality control. I mean, first of all, it's horrific conditions, as you said. They don't know the concentration of the drug that comes from China or Mexico or wherever it comes from, and then they cut it with God knows what. And they're cutting all different. They're not just making in these labs. They're not just making fentanyl. They're making at the same time, they're coke and crystal meth and everything else in many of them. And sometimes they intentionally are cross-contaminating the coke with fentanyl to make it that much more addictive, that much more appealing to their clients. So it's horrific. I mean, no idea. Every time somebody gets even what they think is fentanyl that they're used to, you have no idea what concentration you're going to get it at. And yes, especially, and as I get into this book, fentanyl is 100 times more deadly than heroin in terms of by concentration. But there's many other drugs, including carfentanil, which is often used to cut these drugs, which is 100 times more deadly than fentanyl. So it is 10,000 times more deadly than heroin. So when they start using these fentanyl analogs in their drugs, it's truly poisoning the drug supply. And they do it intentionally often. These traffickers, they don't care.
So fentanyl and carfentanil, as I understand it, are really, in essence, the miniaturization of heroin so that you can transport more of it, make it less likely to be detected. But in doing so, you're concentrating the potency. Is that correct?
Roughly. I mean, they're different drugs, but they're all sister drugs, and they have just level of potency. I mean, a comparable would be comparing a beer to wood grain alcohol in terms of the alcohol concentration. The opioid is so much more potent in carfentanil. And you're right. And people ask, well, why did drug dealers do this if they know they're killing their clientele? Why did drug traffickers? It's all economics for them. A kilo of heroin and a kilo of fentanyl cost roughly the same on the wholesale market, $7,000-8,000. But a kilo of heroin they can sell on the street for maybe $60,000. A kilo of fentanyl can get them $1.6 million worth of supply. I mean, the staggering level of exponential increase in value of fentanyl on the street is why they've switched to it. And it's so much easier to import, half a kilo at a time versus 100 kilos at a time. So it's all, from their point of view, economics, regardless of the human cost of doing this.
When you wrote your book, were you hopeful that you could maybe find sources or some solution to be able to address this? And if so, did it lead you in that direction? Or are you now at the point where you're going, I'm not sure that we're ever going to be able to get to that point where we can curtail this?
No, I wasn't that grandiose that I thought for 1 second I could find a solution where others haven't. I wanted to raise awareness. I mean, one of the issues is I'm sure it's touched. I don't know anybody that fentanyl hasn't touched, albeit peripherally. We all know people who have lost kids or relatives or loved ones to fentanyl at this point. And I had 2 daughters. I have 2 daughters who are now in their early 20s. And I wrote it partly as a cautionary tale that, A, you can't experiment with this drug safely. It's like experimenting with a time bomb safely. And B, like you were alluding to earlier, you never know where this drug is going to hide. The whole premise of this novel is that 6 teenage kids who think they're just drinking alcohol at a party or it's spiked by by somebody else. And he thought he was spiking it with ecstasy, and he turned out he was spiking it with deadly carfentanil that kills all 6 kids. And, as unrealistic, as wild as that sounds, there are lots of stories like that happening. And so for my job, what I was primarily trying to do, apart from entertain, is to write a cautionary tale. So people understood that this isn't a problem just to the downtown east side. I mean, tragic as they are, the hardcore users this has the potential to touch and damage and kill anybody.
When I was citing numbers off the top in my introduction, I talked about the 3 waves, and there are more than 500,000 people in the United States who have lost their lives to an overdose due to illegal drugs. That really doesn't tell the whole story, because the lines were fairly flat until we saw the introduction of fentanyl, and it just took off. What weapons and tools do we have available to be able to try and reduce this tragic loss of life?
Yeah, I mean, fortunately, we do have some, and we were making a bit of a difference. As you said, it was COVID that really sidelined our, our response to the opioid crisis and made it so much worse. But we do. First of all, there's awareness and information. People have to understand what the drugs involve, where it is, and hopefully have conversation with their kids having conversations with each other. I think that does make a difference. Second of all, for people who do have substance issues and substance dependence, there are lots of, options. There's treatment options. But to me, one of the most important one is the opioid agonist therapy, safe supply. I don't know of another substance. You can be an alcoholic for 20 years, a cocaine addict for 20 years. You might damage a lot of people's lives. You might make yourself destitute and destroy your career. You might get into a lot of trouble, but chances are it's not going to kill you. This drug, anybody who's had an opioid overdose has an 8% chance of dying within 1 year of that opioid overdose. Like, that's people who are successfully revived on the street. This has an unbelievable lethality rate. So if you fall into any other addiction for a few months and get help and get out of it, yeah, you might have done some personal and emotional damage, but chances are you're not going to kill yourself. This drug is truly Russian roulette, and that's why it's so different from all the other addictions. And so these opioid agonist therapies, where you replace the drug with a safe supply, people have different political views. Some think, you're just encouraging addiction and stuff, which isn't actually true. But, even if you're against it on moral grounds, it's absolutely saves lives to get people on methadone, and especially nowadays, Suboxone, which is the much more potent opioid agonist. And it really prevents people from overdosing on street drugs if they're on it.
You mentioned that you are at ground zero in the opioid crisis in British Columbia. But I think that there are some misconceptions that the only people who are really dying as a result of these overdoses are people who, call the downtown east side home. That's not true, is it?
Not at all. And the people who are at most risk, statistically, it's still people who are hardcore users who die at the highest rate. But the people who are most risk are first-time users or weekend experimenters, because they have no tolerance. Opioid is like alcohol; you build up a huge tolerance in your system. So somebody who tries it once is at extremely high risk of overdosing, especially if they're alone or their friends take off or whatever. I know of at least 4 or 5 kids from the west side of Vancouver who I knew, granted all peripherally, who have all died of opioid overdoses, and none of them were downtown east side residents. Another group of people are relapsed users, people who've gone clean. That's what happened to Philip Seymour Hoffman. He was off drugs for a long time, and the first time he used, his system couldn't tolerate the dose that he was taking, and that's why he overdosed. So, you're absolutely right. This thing can affect anybody. And then there's that whole other group that you alluded to, people who think they're doing cocaine or some other street drug and are getting contaminated with fentanyl and dying from it. So,
does naloxone really work?
100% it works.
How does it work?
Well, it's what's called a competitive antagonist. So it competes with the receptors. It binds more strongly to the receptors than the opioids does. So it works sometimes with some of these really powerful drugs like carfentanil. It takes huge doses of naloxone. But if somebody gets naloxone, if they're overdosed, if they get enough of it, 100% it will reverse it. And that's why, and a lot of users know not to use alone. I mean, a lot of the downtown east side and other places where they're in Greater Vancouver, where there's communities of substance users, they know to use with each other, and they know to have naloxone. And the best proof of that, Stuart, is that in all of these 1,800 deaths every year that's happening in Vancouver or in BC right now, not one of them has happened at a safe injection site. It's not because they're injecting a better dose of it. It's because they all get naloxone if they do overdose.
So therefore, seeing as we understand that the use of fentanyl or carfentanil is not restricted to just people on the downtown east side, that it can be in anybody's family, is it not then incumbent upon all of us to have a naloxone kit just in case? Because I don't see how we're going to be able to stop people from trying drugs. But if you're not in a position where you can administer or come to the aid of a family member because you thought it wasn't going to happen to you, well, then you could watch them die.
I guess, but most people don't die in front of family members for lack of naloxone. Most people do it because they're using alone, they're in a bedroom somewhere, they're in an alley. Usually, if you call 911, and the thing is, if you find somebody, as a tip, if you were to see somebody that you think, a young person who's not breathing, who's passed out, you could perform mouth to mouth. You could breathe for them until somebody comes. So yeah, I mean, it'd be ideal if we all had a naloxone handy, but the practicality and chances are. But we always give it at St. Paul's and other emergency departments. We always give naloxone kits out to our users when we know, especially after they've had an overdose. We always, they're always instructed by community workers and such to carry it. So, and if you happen to have a store, say you had a retail store in Hastings Street, and there was a lot of people around, that would make a lot of sense for you to carry a naloxone kit. But just for all of us to have our home in case we came across someone that was overdosed, I don't think is practical.
Okay, that's a good point. So, you said you would give a naloxone kit to somebody who has come in because they are suffering from the symptoms of an overdose. Isn't the overdose enough to scare them to moderate their behavior?
No, that's the statistic I quoted you. 8% of people who have overdosed and come to emergency, because usually there's really only two things. There's three things that happen after an overdose. So to step back a sec, Stu, overdoses cause you to die because they suppress the center in your brain, the brainstem reflex to breathe. So it just anesthetizes your reflex. So you stop breathing. Sometimes people are awake and they're not breathing. They're very sedated, but so it's interesting to see. So when you overdose, three things happen to you. Either somebody reverses it right away and gives you naloxone, in which case you're fine. There's no damage done. Or you die, or rarely you're resuscitated too late, 5-6 minutes, and you're already brain dead or close to brain dead. But the vast majority fall into the first two groups. And 8% of people, and the people I see at St. Paul's, almost 99.9% of them are fine. They're post naloxone. We just wait till they wake up, and we watch them in case they have a relapse, in case the naloxone wears off before the drug does. But those people have an 8% chance of going out and overdosing and using again. I just found out today that 9 of my patients in the last 2 years who I saw with overdoses died within 30 days of seeing me from another overdose. And that's tragic, despite all. And we have the best interventions at St. Paul's possible to prevent, to get people in treatment, to get people on alternatives. But even still, I don't know, there's no other condition that's true of. People coming with strokes, heart attack, cancer, whatever. I haven't lost 9 other patients within 30 days of seeing me from anything else ever.
So if we take a look at that graph that we showed the numbers rising through 2018, but there was a dip downward in 2019, what happened? How were we able to then develop a strategy that seemed to be having some positive impact?
Well, governments and communities invested a lot of effort. They into safe supply, into naloxone kits, into opiate agonists. We have a very robust addiction therapy program at St. Paul's that's been developed over the last 5-6 years, more treatment options. So we were starting to make a dent. We were starting to teach the user, the most hardcore of users not to use alone. The safe injection sites were making an impact. Then COVID came along and users were, the opioid crisis got pushed to the back burner right away. Understandably, we were facing a global pandemic. Users were scared to use with groups anymore because they were ironically more scared of COVID than they were of opioid overdoses, which are so much more deadly. And and the other thing that happened is the supply of opioids became so unstable because borders were shut down, and traffickers and dealers were literally throwing in the kitchen sink. As bad as quality control was before the pandemic, it got 5 times worse after the pandemic. So all of that created the perfect storm to make it the worst couple of years of the opioid crisis that we've seen in the last 2 years.
Do you think that we can reverse that trend now that it appears that COVID-19 is starting to be viewed as an endemic disease rather than a pandemic disease, and people are starting to find some comfort of living in a world with COVID-19? Do you think that we can turn the focus back onto addressing this very serious issue?
I hope so. I mean, I don't know for sure. I hope so. You'd think we could. It's going to take a lot of money and a lot of resources. But these are young people, these are people's, husbands, wives, sons, daughters, brothers, sisters. It's worth investing in this group, but it'd take a lot of money and effort, And I personally, you talked about other interventions. I personally am a big believer in legalization and providing free, safe supply to all users, even if you're giving a heroin substitute like hydromorphone, where it's not going to kill them, and then you get access to them to hopefully get them into treatment. I know that's controversial. I think Portugal is a model that proves that you can legalize drugs and actually improve outcomes and decrease crime, by the way. Why not just put all the drug traffickers out of business by out-competing them? Anyway, I know not everybody's going to support that, but a lot of us, most of us in medicine, believe that's the ultimate answer.
But what if we were just to do a cost analysis of what we're doing now and what it's costing us as far as the healthcare system is concerned and crime combined? Would that be, a tremendous savings if we took that out of the equation and just went all in as you have suggested?
I'm not a health economist. but it's just common sense that it would. I mean, you think about the amount of petty crime in this city alone, in Vancouver, that's being driven by, the need to have money to buy illicit drugs that are potentially lethal. It's crazy. Like it's just common sense that it would. And you look at places like you alluded to, how this opioid crisis started, particularly the U.S. with the peddling of the Sackler family and the peddling of prescription drugs. And you look at places in West Virginia and Ohio where whole communities got addicted to opioid. The rate of crime, both petty and violent crime, skyrocketed based on that. So I mean, it just stands to reason in my mind, but I can't prove that for you.
Well, the other component in this, of course, is that there's the lost realization of individual potential. And if we look at what is the most valuable resource that our society has, it's intellectual or personal potential. We contribute. And if we're losing that, is that not a loss to all of us?
Yeah, no, I couldn't agree more. And I talk to these people every day, the ones that we consider the hardest core of the downtown east side substance users. None of them would have chosen this life. Most of them come from, reasonable families. They're not bad people. Some of them are very intelligent people. There's huge potential. And I've met a few who have come out the other side who have gotten over opioid addiction. Many of them become, drug and addiction counselors themselves, and they make the most dedicated, supportive people that really contribute to society at that point. It's tragic to think about all the potential years and lives that we've lost and cut short, especially with fentanyl. That's changed the game completely.
What is it that makes fentanyl or carfentanil so addictive that it's almost impossible for an individual on their own to overcome this addiction?
Yeah. Well, it triggers for some people such an intense stimulation of the dopamine centers in the brain, the euphoria, the high that they get off the first use. It's one of the only drugs that's considered potentially you can be addicted from. Nobody gets addicted the first time they drink. Nobody gets addicted usually the first time they use cocaine, but opioids you can be addicted to right from the start. And fentanyl and carfentanil are these incredibly short-acting, so they're hit so hard and so potently to give that high. So there's that side, but ironically, after time, for many users, they lose that. They get less and less of the high as they develop tolerance. What they then fear is the other side of it is dope sickness. Opioid withdrawal is one of the worst feelings in the world. It doesn't kill people like alcohol withdrawal can, but they feel like they're going to die. They go through hell when they withdraw from opioids. And that's part of the rationale of using opioid agonists, to use longer acting drugs that don't give them the high, but avoid the withdrawal that drives them so often. So it's those two components that make opioids such a perfect addicting substance.
Well, as you said in your book, it is like the greatest high you've ever had, and it's once you've had it, you want it again, and your brain starts craving it. It's very hard to turn away from that. Thank you very much for having this, I think, very important discussion, and I hope that we can put this issue back on the headlines where I think it deserves to be.
Yeah, thanks for bringing attention to it. I totally agree.
Wonderful. Thank you.